Hello everybody, welcome back to Med 360. Today we are continuing the diabetes series with a very important lecture without which everything else seems to be meaningless. Today we are going to talk about the diagnostic criteria of diabetes mellitus. Diagnosing diabetes isn't as simple as a single test. Did you know if you don't have a clear symptoms of high blood sugar, you actually need two abnormal test results to confirm the diagnosis. In this video, we will break down the diagnostic criteria step by step, so stay tuned. And if you are new to the channel, subscribe and turn on the notifications so you don't miss the next video in the series. Thank you. Okay, so what is the diagnostic criteria of diabetes mellitus? Diabetes is diagnosed based on blood glucose levels or HbA1c level. The four main tests used are: Number 1, fasting plasma glucose. Number 2, 2-hour plasma glucose, oral glucose tolerance test. Number 3, HbA1c or glycated hemoglobin. And number 4, random plasma glucose. These are the main four tests by which we can diagnose diabetes. Now let's discuss what are the cutoff values for diagnosing diabetes mellitus. For diagnosing diabetes, the fasting plasma glucose level should be 126 mg per dl or more, or 7 millimole per liter. For 2-hour plasma glucose or oral glucose tolerance test, after a 75 grams of glucose load, the values should be 200 mg per dl or more, or 11.1 millimole per liter. For hemoglobin A1c or glycated hemoglobin, the value should be 6.5% or more, or 48 millimole per mole. And lastly, for the random plasma glucose, the value should be 200 mg per dl or more, or 11.1 millimole per liter. But in the presence of classic symptoms of hyperglycemia like excessive thirst, frequent urination, or weight loss. Now we have discussed the cutoff values of hyperglycemia for diagnosing diabetes mellitus, and these values, for repetition and for summarization, these are: fasting plasma glucose of 126 mg per dl or more, oral glucose tolerance test of 200 mg per dl or more, the HbA1c level of 6.5% or more, and a random plasma glucose of 200 mg per dl or more. Now the second step in the diagnosis after a high blood sugar is the presence or absence of symptoms of hyperglycemia. And these symptoms include excessive thirst, frequent urination or polyuria, unexplained weight loss, polyphagia, excessive fatigue. All of these are the classic symptoms of hyperglycemia. Now a patient presents with hyperglycemia in the presence of these symptoms of hyperglycemia, then we only require one abnormal test to diagnose diabetes. For example, a fasting plasma glucose level of 140 mg per dl or an HbA1c level of 8% will be diagnostic for diabetes mellitus. Now let's consider another scenario when a patient is having hyperglycemia but in the absence of classic symptoms of hyperglycemia. So what we are going to do? We are going to diagnose diabetes on the basis of two abnormal blood tests. We can do this in two ways. Either we do two tests done on the same day from the same draw of samples. For example, we took a blood sample from a patient and did fasting plasma glucose levels and HbA1c on the same sample, and the fasting plasma glucose came out to be 130 mg per dl and the HbA1c came out to be 6.8%. So in this way the diagnosis of the diabetes is confirmed. The other way we can do this is to take two blood samples on two separate days. For example, we took a blood sample on Monday and we did a fasting plasma glucose level on Monday, and it came out to be 140 milligram per dl. Then we took another blood sample on Wednesday and did the fasting plasma glucose, and it came out to be 156 milligram per dl. So in this way the diagnosis of diabetes is confirmed. Now let's consider another scenario. This is also in the case when there are no symptoms of hyperglycemia. Let's suppose we perform two tests on the same day, that are fasting plasma glucose and HbA1c levels. And the fasting plasma glucose levels came out to be 128 mg per dl, and the HbA1c level came out to be 6.3%. So now there is a discrepancy in the result. The fasting plasma glucose is clearly above the cutoff value and the HbA1c level is below the cutoff value. So in this scenario, what we are going to do? In such a situation, we are going to repeat the test that is abnormal, in this case the fasting plasma glucose, and if the repeat test came out to be more than the cutoff value of 126 mg per dl, then the diagnosis of diabetes is confirmed. So this concludes our lecture for today. Now you know how diabetes is diagnosed. But what happens after diagnosis? How do doctors manage diabetes? We will cover these in our next video, so stay tuned to our channel. And let me know, how did you find this video? Was it helpful? Drop a comment below and let me know what topics would you like to cover me next in the diabetes series. Don't forget to like, subscribe and turn on notifications. Thank you.